بسم الله الرحمن الرحيم. The effect of an intervention program on nurses' knowledge and performance regarding management of house dust mites in a military hospital. Introduction. Healthcare settings are complex environments that contain a large diversity of microbial flora, many of which may constitute a risk to patients, residents, the staff, and visitors. House dust mites are microscopic arthropods, live indoor and or outdoor, inhabited by vertebrates including man. Generally, the nurse represents a many-surveillance system at any hospital, so if they realized that nature and the role of house dust mites and their allergens, they might significantly reduce its prevalence. Aim of the study. The aim of this study was to improve nurses' knowledge and performance regarding the management of house dust mites, which could minimize patients and healthcare workers' exposure to infection. Okay. Objectives. To assess nurses' knowledge and performance regarding the management of house dust mites, to develop and implement an educational intervention program for management of house dust mites in hospital environment, to measure change in nurses' knowledge and performance after the program implementation, and to determine the rate of house dust mites infection in the hospital and nurses' houses. Subjects, materials, and methods. Research design. A quasi-experimental study was designed with pre- and post-assessment to fulfill the objectives. Setting. The study was conducted in a military hospital. Subject. The nurses available during the study setting were 66 nurses. The only inclusion criteria was a working experience of at least 1 year. After application of a pilot study, those who remained for the study were 16 nurses. Tools for data collection. 3 tools were used. First, self-administered questionnaire, observational checklist, and laboratory investigation for isolation of mites from dust samples. So, when we talk about the first tool, the questionnaire format consisted of 2 parts. Part 1, which dealt with subject sociodemographic data. Part 2, it consists of 2 sections. Section 1 includes multiple choice questions to assess nurses' knowledge as regards general information about house dust mites, such as definition, multiplication, transmission, life cycle, signs and symptoms. And section 2, which concerned with assessment of subject environmental conditions and management, such as floor, duration of home, natural ventilation, artificial ventilation, presence of animals inside the house, use of vacuum cleaner, type of bedrooms, mattresses, type of blankets, carpets, and curtains. All questions were used as a pre- and post-test. Second tool, which was the observational checklist. Second tools, which was observational checklist. Okay, I can talk without. Huh? Observational checklist to assess the subject's performance as regards environmental care related to house dust mites. It concerned with those 2 parts. First, unit cleaning, which covered 22 items such as bed care, windows, walls, and bathroom cleaning, curtains and the carpet care, using vacuum cleaner, disposal of collected vacuum bag, and using vacuum bag of special air filter as HEAP filter, ventilation control, sanitary for storage, rodent and or insects control. The second concerned with personal hygiene. The third tool was a laboratory study to isolate the mites from dust samples collected from patients' dwelling for identification. Dust samples were obtained once a month from major foci, such as floor, carpet, mattresses, bedding, structures where rat nets are located. An Egyptian modified system adopted to fulfill this purpose. This is the Egyptian modified system to separate the mites. The results. First table, nursing staff sociodemographic characteristics. Most of nurses, 73.3%, were in the age group 20 to 30 years with a high significant difference. And the majority, 70%, were females, 63.3% were married, 53.3% have nursing school diploma, and 63.3% were officers. Working experience ranged from 2 to 17 years. Second table, subject knowledge related to house dust mites. The training program achieved significant improvement in nurses' knowledge level in all topics. Table 3, the comparison between nurses' knowledge grades via program. There was a highly statistically significant improvement in nurses' knowledge grades in both the tests as compared to pre-test. As regards nurses' performance, as regards environmental care related to house dust mites, pre- and post-program implementation, there was a highly statistically significant difference between nurses' performance, pre- and post-program implementation. The program achieved a high statistically significant improvement in nurses' performance in all aspects of house dust mites control. Table 5, concerned with evaluation of subject houses. The house age of the nurses ranged from 4 to 33 years, and most of them, 41.6%, were living in homes within the age category 10 to 20 years. Most nurses, 58.3%, were living in homes within lower floors with sufficient general ventilation. All nurses use vacuum cleaner, but only 41.7% of them with moderate suction power. Percentage distribution of house dust mite in patients' dwelling. 7 house dust mite species were recovered in patients' dwelling. Most common species, 73.3%, was dermatovagoides farinae, while the least house dust mites found, which constitute 16.7%, was Labellus nuttili. Sites of recovered mites. Most sites of recovered mites were indoor, such as bedrooms, mattresses, carpets, decaying floor attics, and outdoor like dust on garden seeds, stored products, and rodent and or bat infested areas. Table 8 shows positive patient dwelling for house dust mite versus nurses' performance. There was a statistically significant relation between nurses' performance and the positive patients' dwelling for house dust mites. Conclusion. After implementing the training program, the result showed highly statistically significant improvement in level of nurses' knowledge and performance. The educational course for nursing staff on house dust mites and allergy proved to be fruitful. Nursing experiences on house dust mites control in clinical settings is important for patient protection and reduction of exposure risk. To prevent hospital allergens, nurses must gain a better understanding of cleaning care and adequately carry out these duties in daily practice. Recommendations. Nurses dealing with patients in rural and urban areas must be acquainted with house dust mites and allergens and gain a better understanding of the cleaning care and adequately discharge these duties in daily practice. Undoubtedly, illustrative refresh courses with handout sheets or booklet is a must. The following recommendations are suggested for hospital and student hostels. Allergic patients should avoid exposure to dust. Regarding house dust mites control, the following measures are recommended. Removal of carpets from bedrooms of house dust sensitive patients, cleaning of beds and the carpet using advanced vacuum cleaner of high power of suction. Blanket and pillowcases must be exposed to sun before and after kept in closed places. And the use of indoor safe insecticide like acaricides if it is a must. A mite map should be established in Egypt by making a survey of mite species in rural and urban areas. Skin prick test is a good negative test and should be used as a screening test. And the positive results should be confirmed by ELISA test. Blood eosinophilic count is an important laboratory test in diagnosing atopic diseases. Culturing of different mite species to prepare different antigens to be used in allergy diagnosis. Hyposensitization therapy using species-specific allergen is a future recommended hope. Introduction of molecular cloning, techniques in allergen identification and sequencing production of recombinant allergens to be used in management of mite allergic patients, especially asthma, in order to reduce asthma mortality and morbidity. Wide scales of using vaccines, and the last recommendation will be verification of antigen for skin test and ELISA to be specific. Thank you.